Hi, everybody. It's David Porter, LADC, and I am here today to talk about treatment of opiate addiction. As I've said in other videos on this channel, opiates are highly addictive. And in order for someone to stop using and keep away from opiates, they're going to require extremely aggressive treatment, which typically is going to consist of several components. The first one is going to be inpatient detoxification, what's typically called inpatient detox, and that can last from 3 to 5 days. The person is, is going to be in withdrawal, and they are going to need to be medically supervised and kept in a controlled environment where they cannot get out and get more drugs, or people can't bring drugs in, at least not easily. Yes, it happens, but it's going to be more difficult. And they're going to be in pretty excruciating pain and discomfort for a few days. And yes, there are medications that can be given to try to ease this discomfort, but in my experience from talking to probably by this time about 2,000 addicts over a 18-year career, it's been my experience that those medications really don't do a whole lot. Bottom line is, when someone gets addicted to heroin, it's going to result in suffering, and withdrawal is part of the suffering. You need to reframe and look on withdrawal as a positive thing. It's that doorway to recovery. You've got to go through this crucible, through this gauntlet of suffering in order to get better. Once someone is through acute withdrawal and the physical discomfort has subsided, they need to go to rehab. Rehab or rehabilitation is another inpatient type of treatment, typically lasting for 28 days. Now, unfortunately, that does not mean 28 days is clinically indicated. 28 days is what the average insurance company will pay for. There are some insurance companies who will pay for a little longer. There's some rehabs that will extend your stay for a little bit, and of course there are private rehabs, typically for celebrities and professional athletes and the wealthy, where you can pretty much stay as long as you need to. Rehabs offer a structured environment where, again, it's going to be difficult for people to bring drugs in or to access drugs, although, yes, of course it happens. Time is going to be very structured. They're going to get you up early in the morning and lights out at a specific time. You're going to get 3 meals a day and snacks. You're going to get good, restful sleep, or at least the opportunity for it. You are going to be attending self-help meetings, group therapy, individual therapy, case management. In some rehabs, medical and dental care is provided as well, which has probably been neglected for a long time by an active heroin addict. There's going to be a lot of informational sessions about addiction and opiates and other drugs, a lot of educational videos. It is going to be a lot of motivation, a lot of saturation in recovery methods. Ideally, the person gets out of this 28-day rehab and they go to an IOP, intensive outpatient program, which is typically on a 3 by 3 by 3 model, meaning 3 hours a day, 3 days a week for 3 weeks. Then it's titrated or dialed down to 2 days a week, 1 day a week, or 2 hour sessions, 3 days a week, whatever. The frequency and length of meetings are reduced, and this is outpatient. Ideally, then they go to outpatient counseling indefinitely, where they meet one-on-one with a counselor, or do group therapy. Group therapy is an excellent means of treating opiate addiction. You get all this support and positive reinforcement. You learn you're not alone in the addiction, and you are going to be watching people succeed. The new people coming into the group, the newbies, will watch the old timers, and an old timer can be 22 years old. It's a term that means how long they've actually been in treatment rather than how old they are. But the newbies will see the old timers and how far they progress in such a short period of time and get motivated and encouraged and inspired to succeed and do better. Now, the next part of treatment is going to be self-help, AA and NA, Alcoholics Anonymous, Narcotics Anonymous. Why? Alcoholics Anonymous, because many people who use opiates are also going to be using alcohol abusively, people who use opiates will be vulnerable to other types of addiction. Alcohol is the most common, and the recovery principles are going to be the same. AA is a superb program. Some AA meetings are welcoming of addicts, others are not so much. They'll say, no, you need to go to NA. Others have a don't ask, don't tell policy. You go in and you basically cross out alcohol in your mind, write in heroin, and the recovery principles are going to be the same. So self-help is going to be a very important part of it. Lifestyle changes are going to be critical. Going to need to get regular exercise, regular hydration, good quality sleep. And here's something extremely important. You're going to need to disconnect from every single person you bought drugs from, sold drugs to, used drugs with. You have to get these people out of your life. There is no room in your life for these people. This is critical to recovery. And you are probably also going to need medication assisted treatment, MAT, which is also called agonist antagonist therapy, or a different type is straight agonist therapy, straight antagonist therapy. This is involving use of medications like methadone, Suboxone, Subutex, naltrexone, or Vivitrol. So more about the medications in another video. I want to thank you for watching. Please hit subscribe. And let's come over here to the webcam. And don't forget to make eye contact with the camera. All right, everyone, thanks for watching. Stay safe. And you know something? If you're using opiates, seek professional help, okay? It is not going to get better on its own. You need to get professional help. You can get out of this. But don't pretend it's not happening. Don't deny it. Don't wait for it to get better on its own, because it won't. If you know someone using opiates, your family member, a friend, talk to them and see if you can get them into treatment, because opiate addiction kills. The average heroin addict has a lifespan of 7 years or less from the time they start using regularly. And it could be the first time they use, could be a fatal overdose. So if you're doing this, please get out of it while you can. Or if you know someone who's using, do whatever you can to help them get out of it. All right. Thanks again for watching, and we'll see you soon for more about medication-assisted treatment. 3, 2, 1.